Great. Welcome, everybody. I'm Dan Polsky, Executive Director of LDI, Penn's Leonard Davis Institute of Health Economics. On behalf of the University of Pennsylvania, the Law School, and Dean Ruger, and Penn's LDI, we're pleased to have so many of you from the Penn community join us in this conversation with Dr. Vivek Murthy. As we honor the service of the 19th Surgeon General and the great legacy of the post, which includes Penn's own See Everett Coop, I want to take a brief moment to mention that we're sponsoring this event in celebration of Leonard Davis Institute's 50th anniversary and its great legacy. LDI was established in 1967 as the country's first multidisciplinary research center devoted to improving healthcare through a better understanding of how care is managed, financed, and delivered. Originally founded to bridge the gap between Penn scholars in business and medicine, LDI now unites all of Penn schools to address the greatest challenges of our nation's health system. In the spirit of uniting schools at Penn, I stand here in the law school to introduce a Wharton professor who will lead in the conversation with our nation's top medical professional. Patty Williams is the Ira A. Lippman Associate Professor of Marketing at the Wharton School. Professor Williams' research examines emotional regulation, how emotions influence decisions, and emotions associated with social identities. She's a perfect choice to moderate today's conversation on cultivating and sustaining emotional well-being. Please welcome Patty Williams, who will kick things off and introduce our guest.
Thank you, Dan, and thanks to all of you for being here today, and those of you who are in the overflow rooms as well. We're so happy to have so many people join us. I want to just briefly introduce our guest, Vice Admiral Vivek Murthy, who was confirmed, as Dan said, as our 19th U.S. Surgeon General in 2014. He grew up going to his father's medical clinic and developed a love for healthcare while he was there. He was an undergraduate and an MBA. He was an undergraduate at Harvard. He did his MD and his MBA at Yale. He's a successful researcher, well-published, a successful medical entrepreneur, and a founder of a variety of programs that are associated with AIDS and various other healthcare issues. I'm extremely happy to be here with him today and to have the opportunity to discuss stress and emotional well-being, which is one of his priorities as Surgeon General. Thank you so much. Nice to have you, Dr. Murthy.
Thank you. It's great to be here.
So if I can begin, my guess is that for most of the folks here in the room, when they think of the Surgeon General, they think of warning labels first. Can you tell us a little bit about your job and about your uniform?
Well, absolutely. Well, first, let me just say how glad I am to be here at Penn. I think one of the last times I came here was to interview for residency many, many years ago. And it was a great program. I actually really enjoyed the interview. But it is nice to certainly be back here with all of you, and we've been looking forward to this for some time. Now, you mentioned the warning labels. How many of you have seen a Surgeon General's warning label on a pack of cigarettes? Now, how many of you actually own that pack of cigarettes? Admit it? Okay, somebody willing to admit it in the back. I see. Okay, so we have warning labels on cigarettes and on alcoholic beverages. And so people have seen those labels and they've heard of the Surgeon General. But a lot of folks don't know what the Surgeon General does. So there are two primary responsibilities that I have. One is to provide the public with scientific information about health so people can make good decisions for themselves and their families. It's especially important now when we have a plethora of information sources, some of which are credible and some of which are not. And I came to realize that very quickly when I began the job during the middle of a measles outbreak in December of 2014. And there were, as you know, is all kinds of information on the internet about vaccines. Some of it is true, and a lot of it is not. But it's not always easy for people to distinguish what's not true and what is scientifically based. And that's where my job comes in. But the other role of the Surgeon General is to oversee one of the 7 uniformed services in the United States government, and that is the United States Public Health Service Commission Corps. The Commission Corps is the reason why I wear this uniform. This is the uniform of the PHS Corps. And our officers include a variety of health professionals who are dedicated to advancing public health in their day jobs and also to responding to emergencies when they arise. So we have deployed hundreds of officers to Liberia, for example, when there was an Ebola outbreak in West Africa, and our officers were the ones who provided direct medical care to those who were infected. We've also deployed officers to Flint, Michigan to deal with the water crisis, to Puerto Rico to deal with the major Zika outbreak there. And routinely during hurricanes and tornadoes, during 9/11 and other disasters, we have sent our officers to respond. So that is what the Surgeon General does. But I'll say that on a personal note, it has been an incredible honor for me to have these last couple of years to be able to serve as Surgeon General. And it's not ever an opportunity I thought I would have had. I didn't grow up thinking that I wanted to be Surgeon General or laying out a 20, 30, 40-year plan for becoming Surgeon General. It was actually rather unexpected. And I'll just to be very open with you, I was not even somebody who thought that government was a place where I would work. I was working in the hospital, I was working on a technology company, doing some nonprofit work, and I thought, I'll just keep working and trying to do good work from the private sector. But it has been an incredible honor. And for me also that, as an immigrant and as the son of immigrants, to have the opportunity for my parents to come to this country, as they did looking for opportunity for my sister and me, they found that opportunity in many ways. And as kids, my sister and I were fortunate to go to good public schools. We had neighbors who looked out for us. We were able to meet friends who recognized who we were beyond the fact that we had funny sounding names and maybe looked different, but recognized that we should be judged not by that, but really by the quality of our ideas and our willingness to work hard. And so I feel very blessed. It's not to say that our upbringing as immigrants was easy. We encountered our share of discrimination and hardship along the way, as nearly every immigrant does, and many people who are not immigrants as well. But on balance, we have just been afforded extraordinary opportunities by this country, and I'm incredibly grateful for that. At my swearing in, I actually shared with folks that my grandfather was a poor farmer in India, and when he was raising my father, I don't think he ever imagined that someday that I would be asked by the President of the United States to look out for the health of the entire country. And that's really the power and promise of America, and I'm very grateful to have benefited from it.
So as America's doctor, you're tasked with looking out for the health of our country, and tasked with stating your own priorities associated with that. Some of those, I'm sure, are determined by the context that you find yourself in when you're appointed, and some are determined by your own sort of values and sense of priorities. Could you talk a little bit about your priorities as Surgeon General?
Well, absolutely. There are two values that guide me as I think about our work. One is a value centered around prevention, recognizing that as a country we have not really invested a whole lot on prevention. We've invested the lion's share of our health resources on the treatment side of the equation. But prevention is really important. It makes sense to people. Most people would rather prevent diabetes and get it and treat it later. But that's not reflected in how we fund and invest in health in our country. So prevention is an important value. And the second important value is health equity, making sure that the benefits of prevention and treatment accrue to all parts of our population. That's important on a practical level, because the healthier our people are, the stronger our nation is. But it's also important on a value-based level, because it gets to this core idea of, are we a country that values all lives, that believes that each and every person matters? And if we are, then we have to ensure that the benefits of prevention and treatment accrue to everyone, and not just those who are privileged to live in the right neighborhoods or to have a certain income level or be born into the right family. So those are two values that guide us. And in 2017, we spent a fair amount of time focused on this issue of addiction. Initially on the opioid epidemic, where we launched a campaign last summer, focused primarily at clinicians, in fact, and at changing prescribing practices. And then later in the year, we issued the first ever Surgeon General's report on substance use and addiction, followed up by another Surgeon General's report on e-cigarettes and youth, which is a growing problem we have in our country. But we're going to continue our focus on addiction during 2017 because it is an issue that's affecting everyone in our country, either directly or indirectly. It's affecting communities of color. It's affecting people who are rich and poor, people who are in rural and urban areas. It has really penetrated every part of our country. In fact, last summer, I was in Alaska visiting a small fishing village called Napaskiak. Napaskiak is actually only accessible by boat. There are no roads to this village. So we took a boat and we went there. And in this village of around 500 people, they had a small room there, which couldn't have been too much bigger than actually the front of this auditorium, where they actually provided medicines and first aid to people who were sick. And in that small village, with that very small building to provide medical care, people had broken in to that building multiple times over the last several years looking for opioid medications. And they told me they boarded up the sides of the building and people then came in through the roof. And it was striking to me because even in this remote village which has no roads to it, the opioid epidemic has reached their shores. And that's why we're continuing to focus on that in 2017. But as we'll talk about a little later today, there are two other issues that are very much on our radar, and they're going to be prime areas of focus in 2017. Those include the area of food insecurity, which is a problem that impacts 1 in 4 children in our country and many adults. And also, we are focused in 2017 on the issue of emotional well-being and chronic stress, which is an epidemic really that is linked to the addiction crisis that we're facing, as well as linked to a host of other chronic illnesses that we care about.
So let me follow up on that. I know you're here today to talk about stress and emotional well-being. Tell me a little bit about stress in the United States and its impact on the health of the American population.
Well, we could start actually, in fact, by just doing a little survey of the room right here. So I know we have folks who are in overflow rooms, and I'm sorry that we couldn't have you all here today, but thank you for joining and being a part of this conversation. But just by show of hands, for folks here in the room, how many people here have felt like in the last month that you've experienced a high level of stress at some point in the last month? Okay, so almost everyone. Okay, we get somebody raising 2 hands over here. All right. I'll raise both hands and a foot as well. But let me ask you a follow-up. How many of you felt that you had healthy ways of dealing with that stress? Okay, so some folks, but a fraction of those who experience that stress. And this is actually similar to what I hear from colleges all across America. So the reason actually that we're focused on this issue of emotional well-being and chronic stress is that stress is a very common experience for people. Now, there are different types of stress. There's the acute stress you might feel when you're, let's say, on a sports team and it's the final minute of the final quarter and the score is tied and you need to drive your team to victory, or the stress you might feel the night before a deadline for a paper or for a problem set, or the stress you might feel right before you go into a room to see a patient, because you want to make sure that you're at your best and you're serving them to the best of your ability. That kind of short-term stress can actually be helpful to us. It can enhance our ability to perform. But chronic stress is a problem. Chronic stress is when that acute response continues for a prolonged period of time. And when it does, the effect on us physiologically, the effect on our body, is not a healthy one. So we find that when you have prolonged activations of your stress response systems and prolonged elevations of your cortisol levels, for example, that leads in part, or the overall chronic stress response can lead also to a chronic inflammatory response, which in turn can increase your risk of cardiovascular disease, of cancer, and a host of other chronic illnesses. And so chronic stress is very much linked to the illnesses that we care about. And here's another thing to keep in mind. Chronic stress is a form of pain. And when I think about the conversations I had all across our country when I first began my tenure as Surgeon General, what I heard loudly and clearly from communities was that they were in pain. Not just physical pain, but people were experiencing a deeper emotional pain. And that emotional pain is a manifestation of stress. It's actually instructive that the pathways in our brain for emotional pain and for physical pain are actually very similar, and you can actually experience emotional pain as physical pain. And so it became very clear to me that if we do not address chronic stress in our country, if we don't look for ways to enhance emotional well-being, then we will be failing to address an important critical driver of illness. And that's one of the reasons why we've taken on this topic.
Can you tell me a little bit about what is emotional well-being? How do you define it? What are its components?
Well, the term emotional well-being is a loaded one. So when you think about, well, let me just ask you this. Just by show of hands, I want to know how many people think about emotions, and don't think about this intellectually, just think about it as a cultural association. So let me ask you this. How many people think our society looks at emotions as a source of power versus a source of weakness? So how many people think our society looks at emotions as a source of power? Okay, I think I see one hand up. How many people think that we look at emotions as a source of weakness as a society? So just about everyone. And herein lies the paradigm that we have to change. Because emotions are a source of power. And I'm not saying that because that's my philosophical belief. I'm saying that because that's what science actually tells us. When we are predominantly experiencing positive emotions, whether that is gratitude or inspiration, or a sense of awe or connection or love, we are able to do more, we are able to handle more, we are able to perform better. When we are predominantly experiencing negative emotions, like fear or anger or jealousy or rage, we may find that in the short term, that might motivate us to be able to do more. But in the long term, it saps us of our strength and our vitality and our energy. I'm sure that all of us have had the experience in life of having somebody else that we know who has gone through a period where they were predominantly in a negative state. And it's not easy to be around folks who are like that. And people have probably felt the same way about you if you've spent a prolonged period of time in a negative state as well. So emotions, though, are a source of power. And you know who knows this well? High-performance athletes. High-performance athletes know that the key to success and victory is not just physical fitness. It's not how much you can lift or how long you can be on the treadmill, but it's also emotional fitness. And that's why the mental game is such an important part of how athletes train. And it's what makes often the distinction between those who win and those who come up short. I'm a tennis fan. Grew up watching a lot of tennis, as well as basketball and a bunch of other sports. But in tennis, I remember when we would watch the championships and it would get to the fifth set. The tennis pros would always say, when you get to the fifth set, it's all about heart. It's not about skill, it's about heart. And your heart is the headquarters for your emotional strength. And that's why part of the paradigm that we have to shift is looking at emotions as a source of power. Now, emotional well-being is that force that allows you to be resilient in the face of adversity. It's what allows you to function on the top end of your performance scale. And the reason this is important is because sometimes when people think about emotional well-being, they think about mental illness. I think we're talking about depression, we're talking about anxiety. But emotional well-being is more than the absence of mental illness. We don't want people to just be free from disease. We want them to actually be functioning optimally, right? It's just like, think about relationships. Like, many of you may be in romantic relationships or may want to be in a romantic relationship at some point. I want to ask people to, identify themselves on that basis. Don't worry, I'm not going to out you. But if you think about the relationship that you want, nobody goes out there saying, you know what, I really want a relationship that's free of pathology. That's really what I'm looking for. Nobody wants an adequate relationship, right? You want an extraordinary relationship. How many people here want an extraordinary relationship? Oh, come on, all of you do. You're just not willing to admit it. No, so everybody wants an extraordinary relationship. They want an amazing relationship. They don't want just an adequate relationship. And similarly, when we think about our emotional well-being, we should be seeking not only to help people treat and prevent mental illness, but we should be seeking to optimize their emotions because their emotions are a source of power.
So much of my research, as Dan said, is centers on emotions, and I subscribe wholeheartedly to this notion that emotions are functional, that they're useful. They help us to respond to challenges and opportunities that we face in the environment, particularly in the moment, right? I've done research showing that athletes feeling anger feel like they're better athletes, and they actually perform better as athletes. It's associated with muscle control and muscle power and all of those sorts of things. And people who want to be good volunteers actually will seek to upregulate the sadness that they feel in response to the negative circumstances that other people find themselves in. Makes them feel like they're a better volunteer, actually makes them donate more time, more money, all of those sorts of things. But I think you're right that this notion that you can overextend, right, those negative experiences into domains where they're not necessarily functional, and they can become harmful over time. Could we switch a little bit to the positive side? And I want to talk about gratitude in particular. It's one of the emotions that you mentioned. Martin Seligman, who's here, one of the founders of positive psychology, has written a lot about gratitude. Can you talk a little bit about the practice of gratitude and how it contributes to emotional well-being?
Absolutely. So, first of all, Martin Seligman has done extraordinary work in this field for many, many years, and so really my hat off to him. And he's just an extraordinary leader in this field. But gratitude, as he and others have identified, is a really powerful emotion, and one that can really influence how we look at our lives more broadly, how we interact with people, and the kind of energy that we bring to our work. There are actually a variety of positive emotions that can do this. And when we think about gratitude, for example, there are different ways of practicing gratitude. And you might say, sure, I feel grateful from time to time. But if we think about it, when we have practices that sustain us, it's important to build habits around those, right? And so if you ask yourself the deeper question, do I have a habit around gratitude? The answer for some of you may be yes, for some of you may be no. And I would say that if we don't have a habit around healthy practices, then in all likelihood, we're not really going to be able to get the full benefit of that practice. And gratitude is one of those. So one of the things that my wife and I started doing after we got married was actually closing our night with just a moment of gratitude where we would share 3 things that we were grateful for that day, and we would share that with each other. And that was a really powerful practice that I found actually was starting to impact my sleep as well as how I felt the next day. But look, we know that there are a variety of positive emotions which have an impact on health. Gratitude is one of them. But the experience of feeling socially connected is another very powerful emotion. And look, I would suspect that just as when I asked you the question of whether society looks at emotion as a source of weakness or power, if I asked you the question of how does society look at social connection as a nice to have or as a necessary to have, the most of you would probably say society kind of looks at it as a nice thing to have. But in a society, in a nation, in a world that value hard-nosed individualism, that it's really people should be able to go it on their own. They should be able to manage on their own. But you know what? That's actually not how we evolved as human beings. We evolved to be socially connected creatures. That's not to say we all evolved to be extroverts, because that's separate. Whether you can be an introvert or an extrovert, but you still need some degree of social connection. The question just is how much. But you can understand from an evolutionary perspective, it was beneficial for us to be connected to other people. If you were connected to other people, you were more likely to have a stable food supply. You're more likely to be able to protect yourself from predators, for example, throughout the long night. So connection matters, and because we have evolved that way, when we are isolated, when we are subjectively lonely, that actually puts us in a stress state, because that's not how our body was built to operate. And that stress can have a lot of the adverse effects that stress from other sources can have. So if we look at the inputs to chronic stress right now, they include poverty, discrimination, violence, chronic illness, as well as loneliness. And there are certainly a host of other factors as well. But the reason that loneliness is important for us to think about is because right under our noses, the epidemic of loneliness has been growing. In the 1980s, 20% of adults in America said that they were lonely. That number today stands at 40%, despite the fact that we live in the most technologically connected age in the history of civilization. And how could that be? Well, it's because technology in some ways has been looked at as the solution to connection. We have a lot of social media platforms and ways for people to connect. And it's not just social media, but think about the fact that you can call anyone, you can text people, you can message them through other apps. You can connect in a variety of ways. But the problem is that we have forgotten in that relationships, different types of relationships are not necessarily always the same. The kind of gratification and nourishment that you get from a deep relationship with somebody who understands you and who you understand is different from somebody that you friended on Facebook who you saw for 2 minutes at a conference 3 years ago and barely have any interaction with or knowledge of. Right? Those are not equivalent relationships in terms of the nourishment that it gives you. That's not to say you shouldn't friend somebody on Facebook who you met at a conference for 2 minutes. Don't get me wrong. Feel free to do that. But my point is we should be mindful of the kind of relationships that we have in our life and whether they nourish us or not. And this is where we have to be careful with when it comes to social media. What some of the research increasingly is showing is that when we use online tools to facilitate offline connection, then technology can be very powerful in strengthening social connection and nourishing us. But if online platforms become a substitute and in fact diminish our offline relationships, that's when things can get to be a little bit dangerous and when we can run into challenges with isolation. You know, I'll lastly share this story with you from when I was practicing medicine up in Boston. I had a patient who won the lottery. Doesn't happen very often, but he won the lottery. And he was a chef at a well-known restaurant in Boston. And after he won the lottery, he quit his job. And he said, oh, this is great. I don't have to work anymore. I'm going to buy a fancy house and a fancy neighborhood. I'm going to move out there, and life is going to be great. And then sometime after that, he developed high blood pressure and diabetes and ended up coming to see me. And I said, how are you feeling? He said, the truth is winning the lottery is the worst thing that ever happened to me because I left work where I had all these great friends. I had all these great customers who I no longer saw. I lived in a neighborhood with people who I didn't really connect with or relate to, and they were often away living in other houses because it was a rich neighborhood and everyone had like 7 houses. And he said, I just lost my entire community. And so we have to remember this because when it comes to one of the great challenges we face, which is one of the challenges we need you to help us solve, is how do we build or rebuild a more connected America? And that starts very locally. It starts with how you build connections right here in your local community, which is your campus, or in the community here in Philadelphia. And that's something that I'd love to talk with you more about because that I believe is going to be the solution for us for not just ensuring that we decrease loneliness rates, but ensuring that we help to address some of the drivers of addiction and other illnesses that we're currently dealing with in the country.
So I'll ask one more question maybe, and then we'll open it up to questions from the floor. I'm wondering if we can get you to talk a little bit about your own experiences. I've recently read some articles looking at high school students and college students who find that their pursuit of success, the stress of studying for the next midterm or the next exam, wanting to make sure they get into the right college or the right grad school, can be a source of social isolation itself. It causes you to pull within yourself and to avoid others while you think about managing your own success. You're obviously someone who's managed a great deal of success over your lifetime, and yet now thinking about this social isolation. What kind of advice do you have to give our audience about finding that balance between being self-focused and being engaged with others in a meaningful way?
Well, that's a great question. I do have some thoughts to share because I didn't do this right when I was growing up and when I was going through training. The truth is I didn't manage stress very well at all when I was in high school and in college, and even in good chunks of medical school and even parts of residency. I experienced a fair amount of stress. I put a lot of demands and expectations on myself. It wasn't imposed on me by my parents or by my teachers, but I had a lot of self-imposed standards, and I wasn't always able to meet them, and that was really stressful. And it was really isolating also, especially because I had a personality that was more on the shy side of the scale, and it was a little harder for me to just get out there and go and connect with people. But a couple of things in retrospect that I wish I had done that I think would have been really helpful. I think one is to recognize that connection can be therapeutic. And if I had known that, I think I would have pushed myself a little bit more to not necessarily have to reach out to people I didn't know at all, strangers, but even to reconnect during times of stress with people who understand me, who see me for who I am, including like very close friends and family. The second thing I wish I had known was about the therapeutic impact of exercise. Now, we tend to think about exercise in our country as something you do for your long-term health. Exercise now so you can prevent a heart attack in 30 years. By the way, that's not a terribly motivating sort of slogan, but it has sort of been the traditional way that, that exercise has been sold. But I'm here to tell you that there's another value proposition for exercise, which is that in the acute setting, in the short term, it can actually have a powerful impact on your mood. And I realized this fairly late in life, in fact, after my training. And so these days, when I am in a period where I'm experiencing a lot of stress, I actually will go to the gym, actually, as a way to relieve stress. And there's a good science that talks about the therapeutic effect of that. And the last thing I would say is that one thing I wish I had also done is to more proactively reach out to others who are experiencing stress and who are undergoing a great deal of stress. And when I look at it in retrospect, they were people I know who recognized I was going through a lot of stress, but didn't reach out to me because they didn't want to intrude. They didn't want to make me uncomfortable. They didn't want to invade my privacy. And look, privacy is important, and sometimes people don't want you to intrude. But we all have the ability to be that source of relief, to be a source of therapeutic potential, if you will, for the people around us. You don't have to have a medical degree or a nursing degree or a pharmacy degree to be able to help alleviate stress and isolation among others. And so reaching out and creating opportunities for people to connect is also something I wish I had done more of, because it would have helped others, but it also, in doing so, would have helped me. So those are some things that I wish I had done, but let me tell you, I was certainly not the model of it when I was going through my training.
One of my colleagues at Wharton in the management department does work on emotions in the workplace, and she's looked at loneliness in the workplace in particular. You can imagine it's associated with lots of job dissatisfaction, turnover, all of those sorts of things that are harmful for individuals, but also organizations themselves. But her research shows that actually loneliness can be vastly diminished with just one friend, right? It just takes one deep connection, one meaningful connection in the workplace to overcome that sense of loneliness that people actually feel. And one of my favorite adages around emotions is this: happiness shared is doubled and sadness shared is halved, right? And this idea that, again, the emotions themselves are social, both the sort of positive side and the negative side, and thinking about that social connection is so important.
Absolutely. You're reminding me that there is one other thing that I think is important to keep in mind in terms of handling and dealing with stress. And that's actually the power of pausing. This is something I wish I had known and really recognized more when I was younger. But we've been talking a lot today about social connection, and social connection is very powerful. But there are times when pausing is also what we need to step back from the craziness, really, of the day-to-day. We live in lives that are increasingly packed with experiences, and those experiences are now coming at you through mobile devices all the time. It used to be before, like when you're riding up and down an elevator, that was actually a brief moment to think. Or when you're riding in the car to and from a destination, that was a moment to pause and reflect. But now our airwaves internally are filled all the time with input. And there's a beautiful lesson here that we can actually learn from physiology, from our own heart. As some of you may know, the heart pumps in two phases. It pumps in systole, where it ejects blood from the heart to all the vital organs in the body, to the brain, to the lungs to the intestines, the liver, and so on. And then there's diastole, where the heart relaxes and where it fills with blood. Now, most people think that systole is really where the action is, because that's where you get life-sustaining blood out to the whole body. But if you understand actually the physiology of the heart, you understand that it's actually during diastole that the coronary blood vessels that actually supply the heart muscle itself with blood, that's when they actually fill. That's when oxygen-rich blood is delivered to the heart muscle itself. And what that tells me is that pausing, in fact, is what sustains the heart. And I think that there's a powerful lesson in there for us. Because if we can build in those moments of pause into our lives, whether it's a meditation practice that you have, or whether it's a moment to just breathe for a minute before you jump into a new endeavor, or whether it's a moment to just stand still outside a patient door before you actually walk in to greet them and provide them with care. Those moments of pause can also help sustain us.
It's a really nice metaphor. Thank you. Are there questions in the audience? Anyone have questions for Dr. Murthy? In the back. Back. You, yes, sorry. Yeah, maybe if you, I don't know if we have a microphone, but if you speak up really loud, I can repeat the question. Is it back there? Ah, thank you. I can't see it.
Thanks so much for coming, Dr. Murthy. I noticed that you said that this year one of the country's missions is to reduce or address food insecurity. And I know that that term has actually been changed from hunger to food insecurity by the administration recently. I was wondering if you could speak to the specific measures you're going to be taking to reduce food insecurity, especially given the budget cuts to, for example, SNAP, and the issues with school lunches.
So great question. So food insecurity is a great challenge that our country is facing. I mentioned early on that 1 in 4 kids live in households that are experiencing food insecurity. Many adults are impacted, and this has impacts on stress in particular, but also on various elements of physical health. Part of our work in food insecurity is, in fact, to look at the range of solutions that are being implemented, not just at the federal level, but also at the state and local level. And here's actually where I find that there are many reasons to be hopeful, because while budgets certainly are tight, on the federal side, and yes, there are debates that are going on right now at a national level on how best to address food insecurity, whether it's through SNAP or through other programs that we have. I think what we sometimes lose sight of is the fact is that there is tremendous potential in local and state-based programs that we have to harness and actually expand. One of the reasons we came to Philadelphia on this trip is because I wanted to visit some programs that were addressing food insecurity right here in Philly. And there's some that have actually done so very well, including the programs that have been run by the Food Trust here in Philadelphia, as well as some programs that are being run by CHOP and by other hospital systems in the area. But what I find when I talk to people in other communities is folks are often isolated and don't know about what solutions are being implemented in other cities. They don't recognize, for example, that programs to repurpose unused produce, so-called ugly vegetable type programs, that these programs can be a powerful way to redirect healthy unused produce into the hands of people who need them the most without necessarily generating a whole lot of extra expense. And so we're at a time where we need to identify, pull up, and really get out the messages and stories of programs like that are working. And that's actually one of our approaches to addressing food insecurity. My belief is that if we harness the innovation at local and community levels, that in combination with ensuring that we have strong federal programs can ultimately help us close this gap and make sure that nobody has to live in a food insecure household.
Thank you. In the back here, in the front. Yes, you.
I'm from Europe, and one of the biggest challenges or things I see that cause stress in American society is the lack of vacation, or one of the I'm facing that I think is super different here is that people don't have a lot of vacation days, even the pressure to not
Well, it's a good question. I mean, this is kind of getting back to our discussion about pausing. And, sometimes vacations are an opportunity for people to pause and to reflect and to physically rejuvenate, to emotionally and mentally rejuvenate. And I've worked in a lot of environments in medicine where people don't take enough vacation, so I know what you're talking about. I do think that one of the larger challenge behind your question is that I don't think we value that pause as much as we should in our country. And I think for that reason, we look at time off as, again, a source of weakness. We look at sleep as a source of weakness. We look at emotions as a source of weakness. These are all things that actually sustain us if we really understand what science tells us. But culturally, we have a shift that we have to make. And in my view, look, yes, we can make changes in laws at a local level, a state level, a federal level, but I think the far more powerful thing to do is for us to figure out how we change culture around this so that we understand that these things are actually a source of power and not a source of weakness. If we do that, then I actually think you will start to see more companies, more nonprofit organizations, more university systems invest in leave for their employees because they recognize that that's a way that they can regenerate and add even more to the company down the line.
Sure, here.
Thank you so much, Dr. Murthy, for coming down. It's an honor to hear you speak. I'm a family physician. I run a health center serving people who are homeless in Philly. And I reflect on my patients as you talk. I see a lot of my younger patients, my 3-4-year-old patients who are already, are already in a chronic stress state. They are moving around from shelter to shelter, living in a food insecure world. And by the time they get older, looking at my older patients, I wonder if they've lived their entire life that way. How do we, on the community level, on the societal level, address the early entry into this chronic stress state?
Well, it's a good question. You know what tell me your name one more time.
Mudit Galotra.
Okay. One of the things that you're making me, what you're describing in your patient population, what you're seeing, this is really tragic. Before young people are even at an age where they can vote or make decisions, on their future, they're being saddled with chronic stress, with often traumatic experiences, which then will have an impact on their lives for years and years forward. Look, I think there's no question that we have to start very early in the lifespan when it comes to equipping young people with tools to enhance their emotional well-being. But it's also important that as caregivers, that we approach our care in a trauma-informed way, recognizing that there are many sources of trauma that people are experiencing them, and some are very evident and visible, but many others are not. I had the experience actually just a few weeks ago of encountering somebody that I thought I knew fairly well. Somebody who had grown up in a background where she was given access to great education. Her parents had a very secure income. They were in a great place in society. She had a lot of security. And it would be easy to think somebody like that probably hadn't gone through a whole lot of trauma. But when she shared with me that she had in fact suffered from deep depression, as a result of physical violence that had been visited upon her, and that she had attempted to take her life on multiple occasions, I was really struck, and it was a humbling moment, and yet another reminder that we can't always judge people, based on what seems like it would be a challenging upbringing or environment, but many of us are exposed to trauma. I think the more fundamental thing here, though, like in your question, is we have to, as a society, find a way to ensure that our young people recognize that their lives do matter and that they have worth that's intrinsic. In 2017, too much of the worth of our young people is tied to external factors, right? We make them believe that how they are perceived on social media, whether they live up to the images of perfection that they see among their peers on social media, that's a determination of their worth. We make them think that whether or not they succeed and hit certain benchmarks in terms of test scores, that's a determination of their worth. We make them think that whether or not they're accepted and understood by their peers is a determination of their worth. And it's easy to feel that way. I felt that way when I was growing up, right? But we have to be able to to convey or to instill in our young people that their lives really do matter. And this is hard because there are a lot of young people who are experiencing discrimination right now, right? Either on the basis of their race or ethnicity or their sexual preference, in the case of many women and young girls in terms of their gender. And so this is not a simple thing to do. But that affirmation of intrinsic self-worth, that affirmation that they are worthy of being loved, that affirmation can come from parents, it can come from caregivers, it can come from teachers, it can even come in unguarded, honest moments with strangers. And that's why I think that as we think about that larger culture shift that we have to make, a shift towards ensuring that people see their value, ensuring that they don't believe that who they are is always determined by what other people think. That shift has to come because each of us in our lives, in our lines of work, in our social interactions, take it upon ourselves to affirm others just as we ourselves need to be affirmed.
So I think we have time for maybe one last question. I'm going to ask it if that's all right.
Moderator's prerogative.
That's right. I have the microphone. Given this priority around stress and well-being, what does success look like for you? How will you know that your efforts here have paid off?
Well, I'll tell you I know we're in a university where we think a lot about data, but I want to give you an answer that's actually much more visceral. To me, success feels like a world that is increasingly driven and fueled by love and kindness. That's what success looks like to me. And we can feel that. You know, many of us go throughout our days and we might read certain things in the news, we may be able to report on data on where unemployment rate is going or mean wages are going up or down, et cetera. But beyond that data, there's a certain way that we feel about the world that's informed by our interactions with people. And to me, the closer we get to feeling that it is in fact love and kindness that are driving our decisions and our interactions with other people, and that are driving the interactions and decisions of people around us, then we're getting closer to a society that's grounded in emotional well-being. You know, I've over the years come to believe that in the end there are really just two emotions that drive our decisions, and that's love and fear. And everything else is a manifestation of one of those. We know that love manifests as generosity, as kindness, as compassion. Fear can have its own manifestations as jealousy, as anger, as rage. But ultimately, it's these two that drive. And when fear drives our decisions more often than not, then it tends to lead us into darker places. It tends to have negative impacts on our health, and it tends to drive us apart and separate us and isolate us more. But when love is driving our decisions and informing our interactions with each other, then it tends to be nourishing. It tends to be not only good for our health, but it tends to build that kind of connection, that cohesion in society that we ultimately need to build that foundation that any healthy and strong society and country really needs. So the real question that I think about in all the work we do is how do we tip that balance in the world towards love and away from fear? And I think about that because our world right now is locked in a struggle between love and fear. And which way that balance goes is informed by the decisions that each of us make on a day-to-day basis about how we treat the people around us, about whether we pause before we react, about whether we seek to understand before we condemn. These are the decisions that we make each and every day, multiple times a day, whether it's in a conversation with somebody in person, or whether it's a decision about what comment I leave on somebody's post on Facebook. These are the decisions that we are making. And collectively, those decisions will inform which way we go as a country. Those decisions that tip that balance between love and fear are more powerful than any policy or program that we can develop as a country. And that is why I believe that the true drivers of change in our country, the forces that are going to allow us to emerge from a time of uncertainty where we are facing great challenges to a place of cohesion where we have solutions to those challenges. Those forces are in fact all of you, the interactions that you have, the decisions that you make. And as young people in particular, you are an especially important force because you can help to set an example for what we should be doing as a society. You can lead with a boldness and a courage and a degree of risk that people older than you are often too scared to take. The great thing about starting, I used to say when I was young and beginning my first nonprofit, I often used to say the great thing about starting when you're young is you don't know what you're not supposed to be able to do. And you just go out there and you try it anyway. And if you can apply that kind of boldness and courage and wisdom to creating a society and a culture that are fueled by love and not by fear, then you can build that foundation that our country needs. You can provide the remedy that many people in our country desperately need.
So I want to say thank you to all of you for coming today. And I want to say thank you to Dr. Murthy so much, I think, for sharing his perspective and really a sense of inspiration. I hope you all leave nourished and inspired to go out and find well-being yourselves. Thank you.